Hey y'all, what's up? Sorry about that. I got all emotional in the other video. But I get emotional when I think about my son, especially during coronavirus time. So I told you that PBS News Hour was talking about what was going on in the nursing homes, and I wanted you to hear what they had to say. So this is what the gentleman had to say about it spreading.
3,600 deaths up from just a few hundred in a matter of days. It's an alarming rise. What is behind that rise?
It's incredibly alarming, and if you can believe it, it's actually an underestimate. What's behind it is just how deadly this virus is in nursing homes. We have older adults with high levels of chronic illness. When this gets started in a nursing home, it's incredibly harmful to the population there.
You've called it the perfect storm. Explain to me a little bit about why.
Well, you have older adults who are living close to one another. You have staff members who are moving room to room, potentially spreading the virus. Remember, we don't have testing. Many of these workers don't have personal protective equipment like masks or gowns or gloves. So they're slowly spreading it throughout these buildings. And so it really is this perfect storm of lots of older adults with chronic illness and staff kind of slowly moving it around the building.
And why do you believe that's an undercount? Do you think we have an accurate tracking system within the facilities? Is there any mechanism at the federal level for tracking this?
So there's no mechanism at the federal level currently to track these numbers. So we're totally dependent on certain state departments of health. Some states have done a great job in tracking these cases and these deaths. Other states are doing nothing. And so that's the first source of this underreporting, is just that we have a lot of missing data. A lot of states aren't reporting. But then even within states, there's going to be a lot of undocumented cases. And then we know there's a lot of asymptomatic cases. That means individuals who aren't showing any symptoms of the virus. So I think the number is much higher than the one you reported.
So it is true that you can have coronavirus and have no symptoms. There's been people that are walking around that would test positive but don't have no symptoms. Some of the symptoms are coughing, headaches, fatigue, short of breath. Those are just quite a few. Fevers. Fevers is the number one thing that everybody is looking for. The second thing is coughing. People will run if you cough right now. And then you have people that are going to grocery stores and are sneezing and coughing and licking on food, and they're just doing all kind of crazy stuff. For what reason? I don't know. The coronavirus is not a joke. People are dying from it. And a lot of people that are sick are worried. And you have these nurses, doctors, police officers, post office people that are going out here on a daily, putting a life on the line to deliver your meal, to deliver your package, to bring you medicine, to check your child, to do all kind of things. And even though there are Starbucks and there's Wawa's and Subway, certain places, they're acknowledging these people. And I thank you for our discounts. I love them. It's a beautiful thing, but a lot of people are not acknowledging the side effects and how them not staying home, how it really puts people at risk. So a lot of people say, well, you don't stay home all the time. No, on Saturdays, me and my kids have been doing this for years. We get up and we go out to the community and we feed the elderly, the homeless, and the people that don't have. We've been doing this for years. I'm a director of a nonprofit organization. I work part-time in the medical field. I have been doing this for who knows how long. So I was in a car accident March the 21st, so I can't lift stuff. I can't do certain things because of the car accident. And, my kids can't do it because they were in a car accident. So we actually have people that help us by loading us up. We have people that help unload us. We have people that set everything up where all we have to do is pick up something that might be like 1 or 2 pounds, if that. I don't know how much one apple weighs, probably about a couple of ounces. Peanut butter jelly sandwich is a couple ounces. So that's the stuff we have to do, pick up. But we still go out in the community to help as many people as we can during coronavirus, because we know if we don't, and I hear this all the time, if you watch or you follow us, Regina Young, the Boys Resource Center, on Facebook, if you go on our website, you will see where we're in the community, and you will hear the elderly people. You will see them lining up, how we tell them they have to be separated 6 feet apart. We encourage this. We give them information about the coronavirus. We gave them toilet paper. And right now, we're in the process of doing another event, May the 9th. And our problem is we need a total of at least $1,000, really, to be able to give people diapers, wipes, toilet paper, baby milk. We have a lot of mothers that are having trouble getting diapers, wipes, and milk for their baby because a lot of programs like WIC, they're open, but they're not open to the public. Like, if you miss your appointment and your benefits got cut off, you really are at a standstill and you're waiting for the office to reopen. I hear a lot of people saying, well, I haven't got my child support check. Because the fathers are not working or the mothers are not working to be able to pay child support. So that's an income that they lost. It's just so much going on. So we tell people, if you want to help, even if you want to donate $1, you can Cash App it to $ the THE boys BOYS. Or you could go on to GoFundMe. You could go on to Amazon Smiles and make orders or purchase everything and make Regina Young and Desire Boys Resource Center your nonprofit organization. We get credit. We're trying our hardest to be able to continue to help people in the community. And we just can't do it by ourselves. We need people to help. We're telling people, if you want to purchase diapers online, you can have them delivered to 156 Broad, BROAD Street, hashtag 106 Houston, HOUSTON, Delaware 19954. You can send it that way. We have a lot of elderly people that need Depends, diapers. We're in need of diaper size 1, 2, and 3 right now. It's crazy how we get phone calls every day, every week, where people need incontinence supplies or food. And we can only help so many people because of funding. And we only get our funding when we do fundraisers. And I can tell you, every month, we usually have, between the directors, 4 to 6 fundraisers a month. And in the month of March, we had 0. We did no fundraisers for the month of March. Maybe I'm wrong. Maybe we did 1 or 2 for the month of March, because everything shut it down like March the 16th. So I think we did 2 for the month of March. But after March the 16th, I know for sure we have not did no fundraisers. And the fundraisers are what helps us get the money to buy food, diapers, wipes, and all to give to mothers and elderly people and help them get food and whatnot they need. Our problem is right now, we can't continue to do that without people. And, a lot of people say, well, how do I know if this company is legit? Well, we have 501c. We're on the IRS website. We're on Amazon Smile. We're on Mission Box. We're on GoFundMe. We're on Facebook. And to get certain things, you have to be 501c. We have videos where you can see where your donation goes. It's a good feeling for you to be able to know that you help a nonprofit organization and you physically can see the rewards when people are coming up getting food, or they're eating, or they're getting diapers or Depends or whatever it is. It's a good feeling, and you are able to say, I helped. I made a difference. And this is an ongoing thing that we have to do all the time. And I can tell you now, when I worked, I used to take 10% of my paycheck and put it up and put it towards a nonprofit organization, because I wanted to make sure I was contributing and donating as well. If you live in Delaware and you have United Way, you can donate through United Way. Our number is 13835. That's our designated United Way number. We're always asking churches to take up offerings if they would like and donate to help with this cause. We have an event May the 9th that we're trying to give out at least 100 diapers and wipes to families. But I would love to be able to triple that amount. But we can only do it if we get donations. So you tell me, what is it that you want to see, or what would you like to see happen during coronavirus time? And if you need help, where do you go?